In the last hour, the Health Secretary Wes Street has told this programme that he's not remotely happy about the government's plans to cut winter fuel payments. But pensioners and the country won't forgive the government if ministers duck difficult decisions. Well, there's plenty to stick around for. Shortly, we'll hear from Wes Streeting's shadow in the Conservatives, Victoria Atkins, as she reveals who she'll be backing in the long-standing leadership saga. Plus, as the Trades Union Congress meets in Brighton for their annual gathering, we'll hear from their president, Fire Brigade Union boss Matt Rack. And as we count down the hours to the head-to-head debate between Kamala Harris and Donald Trump, we'll get the view of Lord Darrach, who used to be Britain's man in Washington. All right, let's get back to the state of the NHS. We're joined now by the Shadow Health Secretary, Victoria Atkins. Good morning.
Good morning.
Shadow Health Secretary now. I need to make sure that I don't make the mistake myself. Let's start with this. I'll come to the leadership in a question in a moment, but Prime Minister says that your government broke the NHS. Is he right?
No, he's not. And I think what we need to have now is a sensible conversation about the future of the NHS. As Secretary of State, I will come onto your programme, Trevor, and be very open about how, of course, the NHS is facing long-term pressures and struggling with many of them, as other healthcare systems are around the world. So we know the pressures that the fact we're all living longer is placing on the NHS. We know the fact that we're living with more multiple long-term conditions that require care and medicines. That's placing a pressure on the NHS. There are also pressures such as, for example, the impact of social media and how that is shaping young people's minds, something that we are all very concerned about. And I was clear as Secretary of State that to build an NHS for the next 75 years, we have to marry reform with investment. And I tried to do that through the productivity plan, which I understand, the tech plan, bringing tech to the front line of NHS services, but which I hear that Labour is cancelling. And what worries me is what we've seen so far from the Health Secretary. The only thing he's done is to give junior doctors a pay rise with no productivity reform.
Well, let me stop you there. I can hear viewers yelling, Streeting's come on and he's blamed you lot. You've come on and now you're blaming demographics and the past. And you had 14 years to deal with some of these problems. You left the legacy of 100,000 infants waiting more than 6 hours in A&E, 60% rise in waiting time for infants over the past 15 years, 800,000 young people on NHS waiting lists. As I said to Wes Streeting, his decisions are on him, and your record is on you.
I completely agree with that. And Trevor, by the way, I wasn't blaming demographics. I'm explaining the pressures that our NHS is facing.
You had 14 years to anticipate and to address it,
so
and you didn't.
If I may just deal, first of all, with infant A&Es. We know infant waiting times in A&Es. One of the last things I did as Health Secretary was to approve a vaccination for a horrible winter virus that can be very, very dangerous for babies and for older people, called RSV. I approved that vaccination to be rolled out this winter because we know that if RSV strikes, then that will add enormous worry for parents, but also adds pressure to the NHS. I've also sought to try and improve vaccination rates for things like measles, because again, if we can prevent these illnesses from happening in the first place, not only is that, of course, much better for families, but it also takes the pressure off the NHS. And the figures that have been referred to in this report, we think, although of course I don't have the data and I haven't seen the report, but we think that may be related to that spike in scarlet fever. Do you remember when parents were very worried about their children, bringing them into A&E? And so these are some of the pressures that the NHS faces day in, day out. We have to find ways to reform it to make it more productive.
These are all quite persuasive explanations, but they still don't really answer the Prime Minister's charge, which is you broke it.
Well, I genuinely welcome a conversation about how we should ensure that the NHS is for the future. But this is not what worries me about the way that Labour have trailed this report. And, you know, they're choosing the headlines they pick, is that they have commissioned this report into England, knowing full well that the health situation in Wales is far, far worse. They have 1 in 4 of the population.
Oh, come on.
Well, no, Trevor, the figures, forgive me, that they have the longest waiting lists in Great Britain. They have 1 in 4 of the population on waiting lists.
Oh, come on. The election campaign is over. You don't need to do that.
No, but my question to the Labour Party, I want to work constructively with anyone who will reform and help our NHS and patients. But if they're going to do this sort of reform, please, they need to also ask Lord Darcy to look at Wales, because the situation in Wales under Labour control has been lamentable. And so, and I say this because my worry is that this report, prepared by Lord Darcy, a very eminent surgeon, but also we don't forget a former Labour minister and Labour peer. This report, I fear, is cover for the Labour Party to raise our taxes in the budget in October, and they are laying the groundwork for this. They weren't straight with us about winter fuel payments. They're not being straight with us about taxes. And we need to have a grown-up conversation about the NHS, but this is not the way to go about it.
All right, you've made the point. Can we talk about the Conservative Party itself? Second round of voting for a new Conservative Party leader takes place this week. Have you decided who you're backing?
Yeah, I've thought long and hard about this. I've had the pleasure of having many, many conversations with the leadership candidates, all of whom, by the way, will have my support should they succeed, because I'm genuinely impressed with some of their ideas and their strengths. But for me, after long contemplation, I will be backing Rob Jenrick. And the reason for that being that I don't think this is a matter of left or right. Actually, I think we need to look at the election result. We have to understand why it is that voters turned away from us. And as I said immediately after the general election on that first Sunday media round, I believe actually that the country is instinctively conservative with a small c. We want a brighter future for our families. We want to have our own home. We want to ensure that our public services are well run. And I believe that Rob and I can find that common ground and reform the Conservative Party to attract those voters back to us.
When you say Rob and I, is this a double ticket?
No.
Are you in some deal with him?
No, I am simply saying that I believe that with the experience I hope that I bring to this conversation, as many other people bring experience as well, we will find this common ground and we will be able to begin scrutinising the government. And indeed, this week of all weeks shows the urgency of that scrutiny, because on Tuesday, we, the Conservatives, have forced the Labour government to have a debate about winter
let's
fuel
not go back to that.
Well, it's really important, Trevor. I have the 10th oldest population by constituency in the country. This is affecting tens of thousands of
I understand that. Can we just stick with your choice? It's interesting. You say it's not a matter of left or right. If that's the case, what is special about Robert Jenrick? Why not Kemi Badenoch?
So one of the things that I spoke about as Secretary of Health was my concern that the social contract between younger people and the NHS was being broken, because the NHS had to keep track with how young people use their services nowadays on their phones and so on. And that is why, as Health Secretary, I brought forward this £3.45 billion productivity and tech plan, which sadly it seems Labour are going to cut up.
What's that got to do with why you've chosen Robert Jenrick?
Because I have long been concerned about the younger generations and what they are facing at this point. And Rob has got, I think, a really interesting story to tell about younger generations. As Housing Secretary...
I think he's pretty much the same age as Kemi Badenoch. What's the distinction between these two?
So, because as Housing Secretary, Rob set out these plans to try to build more homes. He is speaking to younger people. And by the way, I'm not getting into attacks on other candidates. I think they all have their strengths. But I am concerned...
Funny you should say that. Kemi Badenoch's people are saying this morning that the Jenrick camp is doing some dirty tricks.
The urgency of today's media round for me is exposing the Labour's choice to take winter fuel payments away from pensioners. It is the cronyism scandal that has emerged today about Alan Milburn popping into the Department of Health looking at sensitive government documents whilst he still has...
cronyism? He's a former Health Secretary.
Because he has all his business interests advising private healthcare firms. And so the relationship between him popping in and out... I mean, Trevor, you and I can't pop in and out, can we, to the Department of Health?
Well, I don't know, but
why is it that this former Health Secretary with these substantial private interests is being allowed to pop in and share government, sensitive government documents?
Are you telling me that none of that
advice?
ever happened in 14 years of Conservative government? No business leader, no person who had private interests was ever invited to advise Conservative ministers on their area of expertise?
So there is a palpable difference between advice being sought in a minuted and formal environment with civil servants compared to what the Sunday Times is reporting, where Labour's cronyism scandal continues to engulf the Department of Health. I'm here to talk about their cruelty, their cronyism and their cockeyed accounting, which I'm pleased to see you were showing on their chart.
I understand that. Look,
we really have got to do a job
I should just say, by the way, Alan Milburn, of course, is not here to explain why he might or might not have been in his old department. But let's go...
I will be writing to the Permanent Secretary today to try to discover answers. None of this has been declared. That is what is worrying. There may be a perfectly innocent explanation, but the Department of Health is not providing it.
Well, we will find out. I want to ask you about something else, which is entirely in your patch. We understand that the current party leader won't be delivering a speech to the conference. That will be the first time that there won't be a leader's speech at the Tory party conference since 1963. And the reason then was that Macmillan was in hospital with problems with what he thought was prostate cancer, and he resigned, actually, that week. Michael Howard gave a speech in 2005 after he was defeated in the general election. Does this tell us something about Rishi Sunak's political judgment? That he's basically seems to have walked off the pitch.
So I'm not involved in any of the planning for conference, and so I can't confirm.
But you're a leading figure. How do you feel about that?
Because please don't think I'm confirming or denying. I'm simply not involved in those conversations. But in terms of Rishi Sunak's leadership, he gave his all to our country.
Yeah, I'm not asking about that.
We had the general election.
How you feel about the fact that he's just decided, apparently, not to do what every leader since time immemorial has done.
As I say, I don't know about the conference development or the agenda, but what I do know is that Rishi is very, very committed to leading the party and holding this Labour government to account, which is why if you saw him on P&Qs on Wednesday, he shamed Keir Starmer, putting that question to Keir Starmer, why is he prioritising train drivers over pensioners?
It's a character thing, though, isn't it, Victoria? Because your father was a Conservative MP in 1984. Margaret Thatcher survived the Brighton bombing and was on the platform 6 hours later. What do you think he would have thought about a leader who says, I'm off to California?
Well, I'm a little uneasy about drawing parallels between that terrorist attack, which many people were
that's not what I'm doing.
Died by, and hurt.
It's a character thing.
In terms, if I can bring it back to the present day, it will be for Rishi to decide whether what role he is taking at the conference. I do think it's important, though, that we give all of the leadership candidates who make the final four. These are impressive people with a lot of strengths. I think it's important we give them the chance to show their wares at conference. But in the meantime, I've got the job of holding this Labour government and its cruelty, cronyism and cockeyed accounting to
I have to be fair and just ask you what I asked Wes Streeting, because the whole country's talking about it. Should the England manager be singing the national anthem at the Finland game on Tuesday, isn't it?
Yes. I'm not a football fan, but the rare occasions I watch football, usually an English match, I'm very, very happy and proud to be singing the national anthem.
Straightest answer I've had from a politician in a year.
Well, it's patriotism, Trevor.
Victoria, thank you so much indeed.
Thank you.